Fat-soluble vitamins, vitamin A, D, E, and K. They are called fat-soluble because they are not excreted in the urine. Vitamin D and A. I'll highlight these two vitamins now. Vitamin D. The active form of vitamin D is 1,25-dihydroxycholecalciferol. Its function is to maintain the serum level of calcium and phosphorus. Ergo cholecalciferol that we get from the plant source and cholecalciferol from animal source. It's called vitamin D3 and vitamin D2. The vitamin D3 is the inactive form of vitamin D. Okay. The difference between vitamin D2 and D3 is additional double bond and the methyl group. You can see in ergo cholecalciferol a methyl group, it's additional. It is not present in cholecalciferol. And a double bond is present right over here. In the skin, there is 7-dehydrocholesterol, that is an intermediate in the cholesterol synthesis. When the dermis or epidermis layer of skin is exposed to the sunlight, the UV rays act upon it and convert it into cholecalciferol. Cholecalciferol is the vitamin D3, as I told you before. It is an inactive form of the vitamin. Now, the cholecalciferol moves to the liver. In the liver, cholecalciferol performs hydroxylation in the presence of 25-hydroxylase enzyme at position number 25. And we get calcidiol, 25-hydroxycholecalciferol. It moves to the kidney. In kidney, the 25-hydroxycholecalciferol is converted into 1,25-dihydroxycholecalciferol, that is calcitriol, the active form of vitamin D, by another hydroxylation done in the presence of 1-hydroxylase enzyme at position number 1. Formation and synthesis of vitamin is also regulated by the low serum levels of phosphate and the low serum levels of calcium. Phosphate has the direct effect on vitamin D3, calcium have indirect effect. Why indirect effect? Because it activates parathyroid hormone. And the parathyroid hormone has the direct effect on vitamin D3. Calcium indirectly affects through the parathyroid hormone. Parathyroid hormone increases the bone calcium demineralization into the blood serum. And it does not, and further the vitamin D that is formed also causes bone mineralization. Thyroid secretes calcitonin. It has a negative effect, and it does not allow the calcium to come out from the bone and increases its reabsorption. In the intestine, we can see that the vitamin D binds to the receptor binding protein. It interacts with the response element. It causes gene transcription and translation. And the protein calcibindin is formed. It is the calcium binding protein that further increases the calcium reabsorption from the enterocytes of intestine into the blood calcium level. So it increases the overall effect of vitamin D is to prevent the loss of calcium from kidney, to increase the mineralization or excess mineralization of calcium from the bone, to increase the calcium resorption from the kidney, to increase the blood calcium level. Okay, what is the function of vitamin D? I told you before, when there are low plasma calcium concentration, there is increase in the parathyroid hormone. The parathyroid hormone increases vitamin D3. Vitamin D3 causes further mobilization of calcium from the bone. It causes renal resorption of calcium, and it decreases the renal excretion of calcium. And it also increases the calcium absorption from intestine, the enterocytes of the intestine. And as a result is the increase in the plasma level of calcium. Actually, the function of vitamin D is the maintenance. It's the maintenance of the serum levels of calcium and phosphorus. Dietary requirements of vitamin D is 15 micrograms per day from 1 to 70 years individual. Above 70 years, the individuals are required to take 20 micrograms per day. Sources is fatty fish, liver, fortified milk, egg yolk. The diseases are rickets in children, osteomalacia, the softness and the porosis of bone in adults, renal osteodystrophy that causes hyperphosphatemia, and hypocalcemia is also its defect, hypoparathyroidism when there is deficiency of parathyroid hormone, and its toxicity causes nausea and thirst. Now, I'll discuss vitamin A. Vitamin A is present in liver, kidney, egg yolk, cream, butter, fruits, and dark green vegetables. its requirement, the retinol activity equivalence for the males is 900 and for females is 700 units. Its deficiency causes nyctalopia. It is night blindness. Nyctalopia is night blindness. Xerophthalmia, that is dryness of cornea. And a very important issue for females. So vitamin A is interested for females to know that it is for the treatment of acne. It is treated with the retinoic acid, your acne. Mild acne is treated with retinoin. It is the all trans retinoic acid. And severe acne is treated with isotretinoin, that is 13-cis retinoic acid. So it's too important to know the importance of vitamin A. Okay, now the vitamin in the diet we take beta carotene from the plant source and retinyl esters from the animal source. It is actually the storage form of vitamin A. Retinyl esters are actually hydrolyzed into fatty acids and retinol. They move to the enterocytes, intestine cells, where they are converted into retinol and further oxidized to retinol. Retinol is now you can observe, look, retinol is coming from retinyl esters and it is coming from beta carotene diet indirectly. It further combines with fatty acid chains and again produce retinyl esters. Now these retinyl esters in the form of chylomicrons go to the lymphatic system. Further their remnants move to the liver and they are stored in all trans-retinol form. The liver stores the vitamin A in the retinol form. Now whenever vitamin A is needed, what happens? That retinol binds to the retinol binding protein and transthyretin. It moves to the Weyl cycle. Weyl cycle is actually the formation of rhodopsin. It is the Weyl pigment of rods in our eyes that is necessary to Weylize the colors. All trans-retinol. Retinol is converted to all trans-retinol, where it is further isomerized to all trans-retinyl esters. All trans-retinyl esters are oxidatively converted into retinol. This retinol further performs oxidation and it is converted into 11-cis retinol. Now, this 11-cis retinol combines with opsin and form rhodopsin. Rhodopsin is a Weyl pigment, light-sensitive pigment that is converted into all trans-retinol. This is all trans-retinol is the form that is produced in the Weyl cycle. What happens next is that sometimes the retinol is converted to the retinoic acid and this retinoic acid causes gene transcription. Now, how it is done? That retinol is oxidized to retinoic acid and a retinoic acid combines with the response element. After binding to a receptor, this complex combines with the response element and causes gene transcription and translation. Retinoid toxicity. Excessive intake of vitamin A causes hypervitaminosis. The amount should not exceed from 7.5 mg per day. The early signs of toxicity are reflected in three things: skin, liver, and one more very important thing is CNS. The skin becomes dry and there's decreased keratin synthesis. Liver becomes enlarged and cirrhotic. CNS causes there are symptoms of brain tumor due to intracranial pressure. And pregnant women are strictly not allowed to take vitamin A, excessive vitamin A. If the woman have acne, so they are treated with isotretinoin, that is a teratogenic drug. It has the effect on pregnancy. So women are not recommended to take vitamin A excess. First of all, they're allowed to treat their acne and then they're allowed to get pregnant because it's not good for the fetus. It causes congenital malformation. Thank you.